Good morning, class. How are you today? Wow, that's great. So, let us start in our class. Lourdes, please lead the prayer. Okay. In the name of the Father, and of the Son, and to the Holy Spirit. Amen. Our Father, who art in heaven, holy be your name. Your kingdom come, your will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us our sins, as we forgive those who sin against us. Do not bring us to test, but deliver us from evil. Amen. In the name of the Father, and to the Son, and to the Holy Spirit. Amen. So class, kindly check your chair if it is aligned. And after you align your chair, you may sit down. Okay, say present if your name is called. Bagset Adam Samuel. Borja Vince. Cuñado Samuel. Lastimoso John Raymond. De la Cruz Ana. Gundaya Nicole. Suarez Lourdes. Okay, very good. So, class, give ourselves 3 claps and 1 thumbs up for today's perfect attendance. Got it? Okay. So, 1, 2, 3, and very good. Again, class. 1, 2, 3. Thumbs up. Say very good. Okay, class. Before we proceed to our discussion, let us have first some energizer. Let us sing the song, Kung Ikaw Ay Masaya. Okay. Are you ready, class? So let's stand up and let us sing together the song with entitled, Kung Ikaw Ay Masaya. 1, 2, 3, go! Kung ikaw ay masaya, tumawa ka, ha ha ha! Kung ikaw ay masaya, tumawa ka, ha ha ha! Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, tumawa ka, ha ha ha! Kung ikaw ay masaya, pumalakpak. Kung ikaw ay masaya, pumalakpak. Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, pumalakpak. Kung ikaw ay masaya, pumadya ka. Kung ikaw ay masaya, pumadya ka. Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, pumadya ka. Kung ikaw ay masaya, gawin lahat, ha ha ha! Kung ikaw ay masaya, gawin lahat, ha ha ha! Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, gawin lahat, ha ha ha! Okay, so, take 2. Okay, class, let's sing the song faster. Kung ikaw ay masaya, tumawa ka, ha ha ha! Kung ikaw ay masaya, tumawa ka, ha ha ha! Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, tumawa ka, ha ha ha! Kung ikaw ay masaya, pumalakpak. Kung ikaw ay masaya, pumalakpak. Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, pumalakpak. Kung ikaw ay masaya, pumadya ka. Kung ikaw ay masaya, pumadya ka. Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, pumadya ka. Kung ikaw ay masaya, gawin lahat, ha ha ha! Kung ikaw ay masaya, gawin lahat, ha ha ha! Kung ikaw ay masaya, buhay mo ay sisigla. Kung ikaw ay masaya, gawin lahat. Ha ha ha! Okay. So, do you enjoy the song, class? Wow, that's great. Okay, you may now take your seat. So, what was our lesson last meeting? Who can recall what is our lesson last meeting? Yes, Lourdes? Okay, very good. Our lesson last meeting is a virus-related diseases. So, who can define what is a virus-related diseases? Yes? Very good. A virus-related diseases is a communicable diseases. Who can give me an example of virus-related diseases? Yes? Ebola virus. Yes? Another. HIV and AIDS. Okay, very good. Yes. So, the virus-related diseases is a communicable diseases such as HIV AIDS, hepatitis, Ebola virus, and in fact, one of the example is a COVID-19. So, I have here some picture. What have you observed in this picture? Yes? Yes, very good. The picture shows that the girl is washing her hands. Another. What have you observed in the second picture? Yes, very good. The girl was sneezing and she covered her nose. Another picture. What have you observed? Yes, they are washing their hands using with alcohol. Another, who can give me an idea? Yes, they are having a physical distancing. Another, what you have observed? Yes, they are wearing face masks. Very good. So, now, who can give me an idea why I showed this to you, this picture? Anyone? Yes, very good. This picture are the health standard of the COVID-19 because our topic for today is all about the COVID-19. So, who can give me an idea if what is the COVID-19? Yes? A communicable diseases. Okay. Let's read all together if what is the COVID-19? A COVID-19 or a coronavirus disease is an infectious disease by the SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring a special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. So, see how deadly COVID-19, isn't it? Yes, very good. So now, let us see if how the COVID-19 spread from person to person. Oh, okay. Let us see if how the COVID-19 spread. The coronavirus disease spread through first, person-to-person transmission. The first category of it is droplets or aerosols. This is the common transmission. When an infected person coughs or sneezes or talks, droplets or tiny particles called aerosols carry the virus into the air from their nose and mouth. The second category of it is airborne transmission. When you breathe in the breath of an infected person. And the third category is the surface transmission. A less common method is when you touch the surfaces that someone who has the virus has coughed or sneezed on. That is why earlier I said it to you that we must have a health etiquette to prevent these diseases or these viruses. So the second one, why the COVID-19 easily spread all over the world is because of the community spread. When someone gets the virus without any known contact with a sick person. And lastly, because of pets. The animals may have caught the virus from close contact with humans who were infected. Do you understand, class? So now, who can give me an idea if what are the symptoms if you get or if you are infected with the COVID-19? Yes? Cough, very good. Another. Tiredness, very good. So let's see if what are the symptoms of COVID-19 from most symptoms, less symptoms to serious symptoms. Okay. What are the symptoms of COVID-19? These are the most common symptoms is fever, cough, tiredness, loss of smell and taste. And the less common symptoms are sore throat, headache, aches and pains, diarrhea, a rash on skin or discolorant of fingers and toes. And the last one is red or irritated eyes. However, the serious symptoms are difficulty breathing or shortness of breath, loss of speech or mobility or confusion, and chest pain. Do you understand, class? Okay, very good. However, if you have serious symptoms, please seek immediate medical attention. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 or 6 days when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Do you get it, class? Okay, very good. So now, I will give you the ways on how to prevent the COVID-19. Here is it. Number 1, wash your hands regularly with soap and water or clean them with alcohol-based round. Second is Wear a properly fitted face mask when physical distancing is not possible or when in poorly ventilated seating. Third is get vaccinated when a vaccine is available to you. Number 4, stay at least 1 meter apart from others even if they don't appear to be sick. And number 5, cover your mouth and nose when you are coughing or sneezing. And lastly, if you feel unwell, stay at home and self-isolate until you recover. Because we know, we are already aware how deadly the COVID-19 is. So we must follow this prevention and of course the health protocols so that we won't be infected of these deadly diseases. Do you understand, class? Okay, very good. So let us have a recap if what is the COVID-19. Any idea? Yes, Julie Mark? What is COVID-19? Yes, very good. A COVID-19 or a coronavirus disease is an infectious disease by the SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Very good answer. Okay. Now, how does the COVID-19 spread all over the world? Any idea? Yes, very good. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette. Like, for example, by coughing into a flexed elbow, something like this. And to stay home and have a self-isolate until you recover if you feel unwell. Now, for you, what is the best way to prevent the COVID-19? Yes? Okay, very good. Wash your hands. Another. Wear a fitted face mask. Okay? Very good. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spreads. Protect yourself and others from infection by staying at least 1 meter apart from others, wearing a properly fitted face mask, and washing your hands or using an alcohol-based rub frequently. And lastly is get vaccinated when it's your turn and follow local guidance. Very good. Do you understand, class? Okay. So now I will give you some assessment. This is only a 10 question. I will give you 10 minutes for answering the assessment. Okay. And after you answer your assessment, please take note of your assignment. This will be submitted for the next meeting. Do you understand, class? Okay, very good. So, you can start now answering this assessment. So, are you done answering all the questions, class? Okay. So, please pass your papers and let us answer all these questions. So, let us read the direction. Put a check mark if it is the right thing to do to prevent COVID-19 and a wrong mark if it's not. Number 1. Wash your hands frequently with soap and water. Is it check or wrong? Yes, very good. The answer is check. Number 2. Don't tell for someone if you are not feeling well. Isn't check or wrong? The answer is wrong because we must tell our family members that we are not feeling well. Number 3. Go along with your friends if you are feeling sick. Is it check or wrong? The answer is wrong. Because if we are feeling sick, we must stay at home. Number 4. Avoid in the crowded places. Is it check or wrong? Yes, the answer is check. Number 5. Always wear a face mask if you are going outside. Is it check or wrong? Yes, very good. The answer is check. Number 6. Seek immediate medical attention if you have serious symptoms. Is it check or wrong? Yes, the answer is check. Number 7. Stay at least 1 meter apart from others. Is it check or wrong? The answer is check. Number 8. Cover your mouth and nose when you are coughing and sneezing. Is it check or wrong? Yes, the answer is check. Number 9. Wash your hand using alcohol-based rub frequently. Is it check or wrong? Yes, the answer is check. Lastly, number 10. Don't go to the hospital if you have the symptoms of COVID-19. Just ignore it and keep it secret. Is it check or wrong? The answer is wrong because we must tell our parents if we are not feeling well or we have a symptoms of COVID-19. Because that is the one thing important if we are not feeling well. If we have a serious symptoms, we must seek immediate medical attention. Do you understand, class? Okay, very good. So now I will read your assignment. Number 1, give at least 5 important things to do to prevent COVID-19. Number 2, wash your hands with soap and water at home. And ask one of your family member to take you a picture while washing your hands. Print the picture and submit it for the next meeting. Do you get it, class? Okay, very good. So, I think that's all for today. Goodbye, class, and see you tomorrow.